pressure, and so on and so forth. But there is a real problem, that is antimicrobial resistance, which is not spoken at all. Have you heard of this term before coming to this webinar? Are you aware of this term before coming to this webinar? Yes or no? How many of you knew that there was a term like this? Some of you might be aware. Most of you probably this is the first time you're hearing, right? But this is a bigger health problem which is out there, which is going to, be a big threat to the human race. Okay, so in India alone, you see 7 lakh estimated deaths occur due to antimicrobial resistance. So this is, predicted to go up to 1 crore, right? Imagine 1 crore people dying only because of antimicrobial resistance. Okay, that's a big problem. So we need to address it immediately, right? So this is a global burden. Can you see the slides moving? So this is the global burden where you see in India, the maximum number of deaths occur. This is a purple, you see the South Asia, where the death rate per 100,000 is like quite high. If you compare it with Australasia or any other country, if you see India is somewhere here, 76.8 people, like percent are, affected. So it is a big deal. Okay, so we need to address it immediately. So where all do you use antibiotics? So if you see, it is not just for human beings. Okay, it is used in the community, it is used in the hospital when you get sick, right? And animals where, they grow all this poultry or cow or livestock, there also antibiotics are being used, right? And then agriculture for the crops and aquaculture, antibiotics are used. So what? Why it is important to know where antibiotics are used and what will happen if you use it or overuse it in these situations. Is the slide moving? Hello?
Ma'am.
Is
No,
the slide
ma'am.
not moving?
Not moving, ma'am.
Okay, which slide you're seeing now?
Now it is moving, ma'am.
Because I didn't put it in the slideshow. I don't know, some problem. Okay, fine.
Okay.
So examples of
Okay.
how antibiotic resistance spreads. So just look at this picture for a moment, because this is you and me, right? This is not a session for doctors or health professionals. This is for a community which has a significant role in combating this major problem. So if you see this slide, what happens is there are antibiotics, okay? So animals get antibiotics, as I told you, right? So what happens in their gut? The resistant strains develop. If you keep on feeding the animals and poultry with antibiotics, the antibiotic will fight back, right? You become resistant. If somebody constantly, tries to attack you, what do? You develop resistance, right? Similarly, microbes also has that resistance. It will start fighting back. So it will not die if you give the antibiotic. Similarly, for humans also, if you start giving antibiotic, you will develop resistant bacteria in his gut. Okay, so this is a vicious cycle. This goes on and on because the animals go to the, their excreta goes as fertilizer, right? So what happens? This goes to the food that we eat, okay, because it is going as a manure for the food. So the resistant bacteria gets inside the food, and also it can be in the crops that we eat. So it goes to the human gut. The resistant bacteria goes to the human gut. Or if you're going to eat meat, then from the meat from animals or not cooked properly, it goes to the humans. Can you mute? Yeah. So, and then this resistant bacteria does its cycle. So it is, it goes, George, if this person gets admitted in a hospital, he spreads it to the others, and then it goes on and on. Okay, so he spreads it to the community and so on and so forth. So there are two-pronged attacks. One is from the humans and one is from the animals that are being fed with antibiotics. It's either through the excreta or the milk, like it goes to the food that we eat, and the cycle continues. Okay, so simply put, this antibiotic usage creates resistance, and it should be used only if there is a real infection which warrants antibiotics. So what are the causes of antibiotic resistance? So first and foremost, from our side, like from health professionals, what we do sometimes, we overprescribe the antibiotic. There is a viral infection also, we give antibiotics. Okay. And patients not taking antibiotic as prescribed. So like, if a doctor says you eat for 5 days, you eat for 1 day and then you stop it, then again resistance develops. And sometimes you go to the pharmacy and get antibiotics on your own. Sometimes you feel, oh, pona tharava, like, last time I was responding to this. So this time also I will go and take the same drug. So that is not advisable. So if you are falling sick, you need to consult a doctor before you go to the pharmacy and buy a antibiotic. Then you have antibiotic usage in agriculture and, poor infection in hospitals and clinics, poor personal hygiene. Sometimes you don't wash your hands because you have touched a soil, you have touched a contaminated area, you have not washed your hands, then you're prone to develop resistant bacteria. And then lack of laboratory tests that are rapid, which can detect antimicrobial resistance very early. Only now few tests are coming up where you can test the antimicrobial resistance within a few hours of giving the sample. Earlier it was not there, but still we have a long way to go for early detection. So why you need early detection? Because to save the patient's life. Okay. So what happens? Suppose if a patient has antimicrobial resistance, what happens? There are treatment failures, which means whatever drug we give, the bacteria or the microbes fight back. Okay. So the patient is not cured. And there are recurrent infections. This patient has recurrent infection, longer hospital stay, longer recovery time, and higher risk of mortality and long-term complication. And because of long-term stay in the hospital, there is significant financial cost of treatment. And because of hospitalization, the income generated by that person to the family is also compromised. So it is everybody's business to prevent infection. So it is not the doctor's mistake or your mistake or the environmental mistake. So it is your duty as well as my duty to prevent infection rather than treat it repeatedly with antibiotics, right? So as younger generation, most of you are students or research scholars, as the younger generation, you need to be cognizant that taking antibiotics unnecessarily, it is going to cause a severe threat to the human race. What happens is, as you keep on treating the patient with antibiotic, the bacteria from a humble bacteria, like I'm just giving you the example of bacteria, it can happen to virus or fungus or anything. So it's like, it's saying from a humble bacteria like me, you become a superbug. So what is your secret? This superbug is saying antibiotics, because repeated ingestion of antibiotics can make a regular bacteria to a superbug. So like Superman, what is superbug? It is resistant to most of the antibiotics or all of the antibiotics. So it is resisting the fight. It is putting up the fight with the human race, right? So what happens? It conquers the individual. There is full-fledged sepsis, and you are not able to treat the patient with any drugs because the microbes which is ingesting or infecting the person is resistant to all or most of the drugs that are present in the world today. So one other interesting finding right now is the newer antibiotics research is also not happening. Okay. So what we have is what we can treat with. So if we develop resistance to most of the antibiotics that are present here, then we won't have medicines to treat the community or the people if they are getting infected. Okay. So it is important for us to keep this in mind when we are taking antibiotics or advising somebody to take antibiotics. Sometimes in your house, like, you have a small, your mother or somebody is having cough and cold, immediately they go to the pharmacy and ask, எனக்கு amoxicillin kudu, give me this drug. Or because last time the doctor has given you that. So you will yourself go to the pharmacy and ask, give me this drug or that drug. So the pharmacist also gives you this drug, but, repeated ingestion or, actually your condition may not warrant a antibiotic, but still you go and take the antibiotic, which will cause to antibiotic resistance. So this is very, very important to know, because unauthorized or overuse of antibiotics is very, very dangerous. So world over, there is a community which has come together because the World Health Organization has told this is going to be a major problem for humanity. So all stakeholders have come together and they have come up with several ways in which you can deal with antimicrobial resistance. Okay, one is, when is the Antimicrobial Resistance Awareness Week? Can anybody tell me? When is the Antimicrobial Awareness Week? We call it R. Yeah? Anybody? Did you celebrate in your colleges? Did you celebrate in your colleges Antimicrobial Week? What is the color for this particular Antimicrobial Week celebration? Is there any color code? These are all general knowledge, okay? These are all not... okay. So the Antimicrobial Awareness Week, usually, whichever day it happens, it is going to happen 18th to 24th of November every year. Okay, it's a fixed day. It's a fixed day. You can request your institution to celebrate, or, at least create awareness during this week. You can conduct poster presentations. You can have some competitions, right? So you can go to the schools and conduct these programs, because we want to encourage best practice, how antibiotics can be used not just by the doctors, but also the community who are important stakeholders in this particular problem. Okay, so what we see as doctors is sometimes the public, like when patients come to us, they are not satisfied if we just say, no need for antibiotics. We'll just write paracetamol, or we'll just write a cough syrup. We'll say you don't need an antibiotic, but the patients usually are not happy, because they think antibiotics only can save them, or giving antibiotics only will cure them. So it is, both sides, two hands should come together to clap, right? With one hand, you cannot clap. So it is as much the responsibility of the community to create awareness or to follow these best practices as much as the doctor or the health professional. Otherwise, it is going to be a futile exercise if one of us only are going to talk. Suppose you are only saying, oh, antibiotic awareness, and the doctors don't prescribe, or vice versa. Then this exercise is a very futile exercise. So both sides should come together, and there should be policy makers like, the government and the, the machinery, entire machinery, to address this problem. That is why the World Health Organization, they have come up with a few strategies, how we can engage the community, how we can make you part of this particular, solution finding. It is not, enough if we talk about the problem. We have to talk about the solution, right? So what we can do? So one is celebrating the Antimicrobial Awareness Week. If your institution has not done it, you can start from this year onwards, 2024 onwards. So you can have some awareness kits, you can show some videos, and you can also have some poster, or painting competition for school children, so that at that young age, these problems are imbibed in their minds. So they will grow up to be a very responsible citizen. And other important thing is, as I told you, I request you all to avoid going to the pharmacy and taking antibiotics on your own, because we don't know which antibiotics is for what, because you are not doctors. So what happens is, sometimes instead of taking a narrow spectrum antibiotic, the pharmacist also will not know, because many of the pharmacies in India are still not regulated, especially the antibiotic sales are not regulated. Unlike the West, where even a single dose of antibiotic is not given over the counter in the pharmacy. So today, if you walk into a pharmacy and ask for a high-end antibiotic, right? If you ask for ciprofloxacin or, cephalosporin, any high-end antibiotic, immediately the pharmacist is going to give you. He'll even show you 2-3 brands, right? And give you the highest priced brand or whatever it is. But in the West, it is not like that. Without a prescription, even a single dose will not be dispensed from the pharmacy. So that is the difference. So that is why low and middle income countries, especially countries like India, are bearing the brunt of this antibiotic resistance or antimicrobial resistance, because our antimicrobial sale is still not regulated to the fullest extent. Okay. So if it is not regulated, from as a community, as a common man, you and I can avoid asking for antibiotics. If you have a fever, please go to a doctor. If it is very mild, please take only paracetamol. And if it doesn't subside, then go to a doctor. And only if it is warranted, take antibiotics. Because if you start using the high-end weapons, right? Like, bigger antibiotics, like, there are meropenams, like a lot of bigger, higher end antibiotics are there. So if you start using it for common cold, then if there is a real need, these antibiotics will not work. So it is a danger. Okay, it is a danger not just for you, but also to the entire community. Because once you develop resistant bacteria, you will be spreading it in the community, right? You understand the problem now, you understand the magnitude now, because we are talking about polio, we are talking about COVID, right? How during COVID we were all in lockdown because we were afraid whether we will spread it to others. So all of us were wearing masks and, staying inside the house and such things. But antimicrobial resistance is even worse because many are not aware. At least COVID had certain, in the radio or in the phone, many people were giving us messages about the dangers of COVID. But antimicrobial resistance, not many media covers it and not many platforms talk about it. So it is there like a tip, under the iceberg. Like, there is an iceberg where the major portion is hidden under the sea, under the water, because it is not visible outside. So antimicrobial resistance is the new public health danger which is awaiting us. We are talking about climate change. Everything is interrelated. Climate change, environmental health, antimicrobial resistance, everything is, linked together. Let us see how. So there is another strategy. One, I said, celebrating the Antimicrobial Awareness Week. The other strategy is to know what is antimicrobial stewardship. It is nothing but not using antimicrobial. It doesn't say don't use. It only says identify the small group of patients who really need the treatment. Okay. And then explain, reassure, and educate a large group of patients who don't. So each of us, it's not the responsibility of the doctor alone. It is the responsibility of the community and the patient also to understand that all diseases does not need an antimicrobial treatment. Just fever, no, I'm not going to give you an injection. I'm not going to give you antibiotics because your fever doesn't need a antimicrobial. It is a simple viral infection which will go on its own, right? The doctor has to take the decision. So as I told you, it is not the responsibility of just the doctor. It is also the responsibility of you not to ask the doctor for antibiotics or not to go to the pharmacy and ask for antibiotics. So please take this message very, very seriously. Okay. So it's like least harm to assure or to ensure that least harm to the current and future generation. All of us have to follow this rights, 1, 2, 3, 4, 5, 6, 7 rights, right? Right antimicrobial. So we cannot give a high-end antimicrobial for a simple cough and cold. Right patient, right? Right time, okay? Right dose, right route, right duration, and right documentation. So these are very, very, very important for preventing antimicrobial resistance. So from your side, what I would expect is not to ask the doctor, not to go to the pharmacy and buy antibiotics on your own. And if you are being prescribed an antibiotic, please take the full dose. If you take for 2 days and stop, then that particular bacteria or microbe will develop resistance, right? So take the right dose, take the right for the right time, and do not ask the doctor for antibiotic if it is not warranted. So as I told you, it is a holistic approach. It is not only humans. There are also environment, water. I told you there are like bacteria which can be resistant to microbes. I also told you about the animals which can have microbiome which are antibiotic resistant. So it calls for what is called as a One Health. So One Health is a newer term which we have been following, but they have now brought to everything together under one umbrella, which is called as a One Health approach. That is by the World Health Organization. So what they say is we have to treat everything in toto. We cannot treat only the environment, or we cannot treat only the humans, or we cannot address only the animals or flora and fauna. So it has to be taken as one unit, because our health depends on the environment, and indeed, in turn, it is dependent on the health of the animals. As I told you, how antimicrobial resistance spreads. So we need a healthy human, we need a healthy ecosystem and healthy animals, so that this planet Earth will survive, or it will thrive for a longer period of time. So it is all interrelated. Okay. So what you and I can do: say no to antibiotics. That is my first advice to you, as I already told you. Try to have an organic way of living, because a lot of this poultry and all these places where they breed animals, they give these animals a lot of antibiotics. So try to ensure that you buy your meat or vegetables from a place where they don't use all these antibiotics to make the chicken or any other organism bigger or healthier. So try to make organic living a way of life, so that there is less pesticide, less antibiotic, and less antimicrobial resistant. And then try to have or practice environmental hygiene. Okay. Try to address climate change. Try to address air pollution. Try to address environmental cleanliness, because all these dirty water, which are in the drainage, it has a lot of bacteria which are antimicrobial resistant, a lot of organisms that are antimicrobial resistant. So you need to have all this. Even one small step you take can bring about a big change. And very importantly, at the individual level, try to maintain personal hygiene. So when you go out and buy vegetables and come, try to wash your hands with soap and water. Okay. Or when you're traveling, you're going to a public place, try to come back and wash your hands. And if you're sick, please don't go out. Like if you're sick, try to wear a mask or stay indoors if you're not able to go out. And toilet hygiene is very important, because the water that goes to the drainage has a lot of antimicrobial resistant organisms which can spread to the community. Like how polio spreads, right? It spreads through all this fecal-oral route. So that also can happen. And personal hygiene is very, very important, which you can do on your own. So all these things you can do, right, at your individual level. It doesn't need a political will or a doctor or somebody to come and tell you, please do this. So you can, have your nails clipped, you can wash your hands, you can practice sickness hygiene, you can practice dental hygiene, you can practice toilet hygiene. And you also can take part in whatever simple way you can in the environmental hygiene and climate change as well. And organic living, again, you can tell your family or people who are going and buying, stuff for you. You can tell them to buy from specific shops which are organically grown. All this, like chicken or eggs or any other, vegetables, or so on and so forth. And most importantly, please tell to yourself and your family, no antibiotics. I'm not saying no antibiotics means as a blanket rule, but no antibiotics or antimicrobials unless it is absolutely warranted. So don't take these antimicrobials unless it is absolutely warranted. Okay, because that's a big danger that is looming very, very soon. If we become resistant to most of all of the organisms, then the human race itself is in danger. I may sound very dramatical, but that is the reality, because we don't have many antibiotics now to give you. Even if somebody is sick, there are only X number of antibiotic or handful of antibiotics that are sensitive, like which the organisms are sensitive now. So I'm seeing patients in the clinic just with small urinary tract infection. Earlier, it used to be sensitive to many drugs, right? Earlier, at least few years back, commonly used drugs are very sensitive. But today, I just got a result of a patient like half an hour before I came to this talk. I was quite shocked to see the result. It's a common organism which we call as E. coli, but it is resistant to common drugs. It is resistant to Norflox. It is resistant to amoxicillin, everything. So it is only sensitive to high-end antibiotics. So I cannot give that antibiotic to this patient right now, because if I spend that also, then if the patient gets infected again, then she may not have antibiotics to consume, because the organism presently is resistant to most of the commonly used antibiotics. So which is very sad, because that is because recurrent consumption of antibiotics or antimicrobials. So it is not a simple problem. It is a big problem where you and I can have a big role to play, provided we join hands and work. It cannot be a single person, like, or a doctor alone playing advocacy here, but it is also from the community. You have to be cognizant of the dangers that are lurking because of these antimicrobial resistance. So finally, I would like to just emphasize on some of the key messages. So remember, antimicrobial resistance is entirely human made. It is man made. Okay. It is not natural. It is man made, because if an organism evolves and develops resistance, it is because of regular consumption or overuse of or inappropriate use of antimicrobials. It is not like, the bacteria or the virus already know, okay, I'm going to be resistant. No, it is because we are training them to do that. We are training them to become resistant. Okay. And it is reducing the effectiveness of antimicrobials to treat infections. So, which is very dangerous. And it is happening now. It is not like something tomorrow or in the next 5 years. No. Right now, we are in the middle of this particular pandemic. We were all talking about COVID. This is equally dangerous or even more dangerous, because it is happening now and not many of us are aware it is happening now. Okay. And also remember, the research on antibiotics is still a long way to go. We have only very new antimicrobials that are developed in the last decades, like, 2-3 decades. We have very few antimicrobials which have come up in the market. So our weapons, or our weapon to fight this antimicrobes, the microbes are very, very less. The microbes are getting stronger. Okay. So remember that. So the misuse, overuse, and inappropriate use of antimicrobials contribute to antimicrobial resistance. So antimicrobial stewardship means rational use of antibiotics. So it's not just the doctor's duty, it is also your duty to make sure that you don't consume or inappropriately consume antibiotics. Please don't, go to the pharmacy and ask for antibiotics. Last time எனக்கு செப்ட்ரான் கொடுத்தாங்க, last time எனக்கு amoxicillin கொடுத்தாங்க, அதே கொடுங்க. No. Again, what will happen is that your gut microbiome will have resistant bacteria. And not just that, within 2-3 days, if your fever comes down, if your cough comes down, then you will stop taking the antibiotics, which is again even more dangerous, because the microbes constantly evolve, and again the resistance become stronger. Okay, and it is not just that, you also are going to infect the water and the other places around you with the AMR strains. Okay, so it is very, very dangerous. So make sure there is rational use of antibiotic. And even if you're in the family, please educate your family, please educate your neighbors, please educate whoever is taking irrational use of antibiotics or antimicrobials, not to do that without any proper indication. Okay, so that is the only thing I would request. And as the next generation, the younger generation, take this as a cause. Try to create awareness, not just among your fraternity, but also others with whoever you are coming in contact with. Because this is a big problem which is lurking and often under-spoken or informed, because many of us are not informed about antimicrobial resistance. And sometimes there is also misinformation, which means they say, if you take 2 days, it is enough, or 3 days, it is enough. It is not like that. Depending on the infection, the duration and the dose of antibiotics has to be tailored, which only a doctor can do. So you cannot self-medicate yourself, which is going to be a big problem for the entire community. Okay, so with that, I again thank you. Thanks management and Chitra ma'am and all of you for your patient listening. So as I said, it is a collective effort. And I hope, it can be done as a concerted effort to address this major public health issue. Thank you and have a wonderful day. And if you have any questions, I'm here to answer.
Thank you so much, ma'am. So participants, you can ask your queries to ma'am now.
Ma'am, good evening.
Yes, ma'am. Continue, ma'am.
Yes, ma'am, please
Ma'am,
continue.
you have told that you can use, they are using antibiotics for the growth of the animal which is producing the food. So, is there any alternative to be replaced instead of antibiotics?
Sorry, can you please repeat that question, ma'am?
Ma'am, you told that the animal producing, which is food, that is, they are being given antibiotics for their growth.
Yeah.
So, is there any alternative to replace this antibiotics with less side effects?
Yeah. So what I was trying to say is, say no to overuse of antibiotics. If the animal is really infected, the animal has having mastitis. Say, for example, the cow is having some infection, right? So I'm not saying don't give antibiotic. I'm only saying give it only when it is necessary, not inappropriate or overuse of antibiotics. That is what is called antibiotic stewardship. So if you keep on giving this for various reasons, then the gut microbiome of the cow or any other animal will become resistant to the regularly available antimicrobes.
Thank you.
Ma'am,
Yeah.
how do the chronic patient can overcome AMR, ma'am?
Chronic patient means who?
If the suppose if the patient is definitely need the antibiotics and they develop resistance towards the organism, how do they can overcome?
Yeah, that is what. See, we have only handful of antibiotics right now because
Okay.
most of the antibiotics have become resistant.
Mm.
As a public health physician who also see patients, I'm very much worried about that. Because if there is a chronic patient, his immunity will already be suppressed. He won't have the natural immunity to fight the regular organisms. So with a small bunch of antibiotics which are sensitive, if I use that for simple illness, I may not have any option, right, to treat him for the real need. That's what I'm talking about. So to prevent that, we need to act now at this moment, at this second.
Yes.
Because that is the magnitude of this problem.
Ma'am,
It is
one more
difficult. Yeah,
one more
yeah.
question, ma'am. How do you relate multi-drug resistant and AMR, ma'am?
Meaning multi-drug resistant and AMR.
Yes, ma'am.
It's not like a same antimicrobial resistant is a broad term. It's
Yes,
a broad term. Antimicrobial resistance is like an umbrella term. Multi-drug resistance means more than one organism, one antibiotic, the organism is resistant. It's just a small, kind of subsidiary in that major umbrella.
Okay, ma'am. Thank you, ma'am.
Yeah.
Good afternoon, ma'am. Good afternoon, ma'am.
Thank you.
When in India, according I have one doubt.
Ah.
How do these bacteria develop resistance, and what is the underlying mechanism by which they are killed by antibiotics? Is
So
it through the underlying mechanism of killing the
Yeah, so
bacteria
there
by
are a lot
antibiotics?
of ways in which, the antibiotic resistance happens. One is a gene mutation, because antibiotics acts through different, mechanisms. It's not just one way the microbes or the antibiotic acts on a microbe. It is through the cell wall, or it is through the protein, or it's through various other mechanisms. Sometimes there are gene mutations which occur in the microorganisms, which leads to antimicrobial resistance. Like, for example, colistin resistance. Colistin is a big, good antibiotic which we have had as a backup, right, in severe infection. But right now we see a lot of colistin resistant strains because of certain mutations in, I think MRC genes like that. So genetic mutation is a very common cause, and sometimes cell wall mechanisms alter. So yeah, like this, many ways in which the bacteria can or the microbes can adapt itself to develop resistance. It's not a single pathway or single way it will develop resistance.
Thank you, ma'am.
Yeah.
Good afternoon, ma'am. Ma'am, am I audible?
Are there any other questions?
Hello, ma'am. Good afternoon. Hello, ma'am. Good afternoon.
Yeah, good afternoon. Tell me, ma'am. I'm here. Tell me.
Ma'am, according to you, when in India antibiotics won't be sold without prescription?
Sorry?
Is it nearer or it will take more time? And what are the reasons, like from the government side or the bodies in India, it is not implemented till now, or when it will be implemented according to you, ma'am?
See, there are a lot of systems in place, but there is no monitoring. There is even if you sell something, there is something called as DCGA, Central Drug, CDSCO and all that. But who's going to bell the cat? Who's going to make inspections in the pharmacy? How many pharmacies are really regulated, manned by people who are qualified in pharmacy? Right? So that we don't know, because our country is very huge, and many places there are no doctors, doctor-patient ratio is also very skewed. So in those situations, the only life savior is a pharmacy or small, pharmacy which dispenses drugs. But having said that, what the government has done, they have done a lot of, in fact, 2012 itself, there is a program, antimicrobial resistant to address antimicrobial resistance in India, that came in 2012. But, as with any other measures, or, it has to reach the grassroots level. And there is also this AMR surveillance network the government has established, right? Which is again taking shape and evolving. So it is going to be a few years before we see all these regulations in place, right? And then make it a foolproof method for us to buy antibiotics in the pharmacy, or regulating the sale of antimicrobials. It's going to take a few more years. Though already some programs are there, national program on AMR, there is action plan for AMR, and also there is AMR network, surveillance network. So all these are in place, and slowly it is taking shape.
All right, ma'am. Thank you.
Yeah.
Anyone else have question? So if there are no more questions, we can conclude.
Okay. Thank you. Thank you for the opportunity.
Ma'am?
Yeah.
Yes, ma'am. Ma'am, I now invite Dr. Ram Kumar, the coordinator of the Bairak EUA Center at PSGR Krishnammal College for Women, to deliver the vote of thanks.
Good afternoon. Greetings to one and all present here. I feel privileged in proposing the vote of thanks. I would like to express my gratitude to our founders, Sri G. Govindarajulu and Srimati Chandrakanti Govindarajulu, for giving us this wonderful institution. I thank our managing trustee, Sri G. Rangaswamy, our chairperson, Dr. Nandini, our secretary, Dr. N. Yashoda Devi, and Mrs. S. Vasanta, Dean, Student Affairs, PSGR, Krishnammal College for Women, for their unwavering support and encouragement. I thank our principal, Dr. P. Meena, for her constant support. I extend my heartfelt thanks to Dr. Sudha Ramalingam, Professor and Head of Community Medicine at PSG Institute of Medical Sciences and Research, Coimbatore, for accepting our invitation and helping us to carry forward the philanthropic work envisioned by our founders. I extend my sincere thanks to Dr. Sudhakaran, General Manager, Golden Jubilee Biotech Park for Women Society, Chennai, and his team, Ms. Priyadarshini and Ms. Sakti, for acting as a pillar of support in all our endeavors. Thank you all. I thank the support provided by the faculty members and head of the Department of Botany, I also thank the DST FIST coordinators. I sincerely thank all the participants and the faculty friends from various colleges across India for their prompt response in making this program a success. I would also like to thank technical personnel and other individuals for their prompt assistance. Once again, I thank you all for making this event a grand success and wish you all a beautiful day ahead. Thank you.
Thank you and bye.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Dear participants, all of you, please fill the feedback link. You'll get an e-certificate.
Thank you, ma'am.
Yes, I'll post the feedback link once again. It is showing already. So I have sent the link once again. If not, we have also emailed the link to all the registrants. You can try there also. So the e-certificate will be sent to you once you have completed the feedback form.